Hello, my name is Ruth Letizia, and I'm a general pediatrician in Mesa, Arizona. Today I'd like to talk to you about screening for maternal depression. I first started to learn about screening for maternal depression when we were participating with a quality improvement project in my practice through the Arizona chapter of the American Academy of Pediatrics. We, at that time, really didn't know that much about maternal depression screening. I'd heard about it when I went to conferences, but I wasn't familiar with the Edinburgh screening tool at all, and I didn't really know any of the data that looked at the sensitivity and specificity. When we were trying to decide a quality improvement project, one of the other pediatricians in the practice was very interested in doing maternal depression screening, and so we decided to go ahead and do that test. And after she reviewed the literature to us, we really felt that that was going to be something that would be helpful to our patients and to our patients' families. When we were looking at implementing the Edinburgh screening tool, we'd actually already participated in a quality improvement project, so we knew the importance of planning ahead. We sat down and wrote out a policy and a procedure, and we really made sure that we hammered out a workflow that would make sure that this wasn't going to take a lot of extra time. We asked for the opinions of the front office staff, the medical assistants and LPNs and the nurse, so that we made sure that we were all on the same page. We spent some time talking about what were we going to do if we got an abnormal Edinburgh depression screening, and developed a crisis plan workflow and recommendations for interventions depending upon the score. And then finally, because my practice manager had the foresight to think about this, we also wrote down our crisis plan and made sure everyone knew where it was. So if there was an occasion where our care coordinator and our triage nurse were simultaneously out of the office, at least we knew what we were supposed to do. So I wanted to talk about an experience that I had with a patient. This was a new family, mom and dad, a new baby. The baby was healthy and doing well. And mom was someone that I didn't know. This was the first encounter that I'd had with them at their 2-month well baby. They had seen another physician in our practice prior to this. So when I was talking to them, she seemed tired. And she seemed a little bit stressed, but certainly I felt with the support of her husband, who is very active and involved, and a healthy baby, she was saying all the right things. So I thought that she was probably okay. Then I have to confess as an afterthought, I looked at her Edinburgh scores and her test right before they left. It was literally as we were wrapping up, and I said, oh, let me just look over your Edinburgh test really quickly, just to make sure that we don't have any other things that we should talk about. And when I looked at her Edinburgh test, I was really shocked. Her score was very high, and she actually did check off some concerns about self-harm and thinking about hurting herself just because of all of the stress. So after I looked at that Edinburgh, I looked back at her and I looked at her husband and I said, I think there are some other things that we do need to talk about before you leave, because I feel like you are really hurting and stressed and sleep deprived, and you're not letting the people that you have in your life know about how severe your symptoms are. At which point she really broke down and started to cry. It started a conversation between herself and her husband. And of course, it was the day that our care coordinator was out of the office, but fortunately our triage nurse knew exactly where the crisis plan was located. So we had her sign a consent form. We took the Edinburgh test and we faxed it over to her OB/GYN. We followed that fax up with a call to make sure that they had received it and asked if they could emergently work her in. And her OB was able to see her that day. She was started on an antidepressant. She and her husband decided to go ahead and go to counseling as well. And she was supported with some information about some online support groups. And when we saw her back again at her 4-month well baby, she really thanked us for taking the time to look and not just look at what she said, but what she wrote. And I think for whatever reason, people are more likely to write down their true thoughts and feelings than if they say them aloud. So after that experience, I have to confess that I'm really sold on doing that Edinburgh depression screening for moms. We do it at the 1 and the 2-month well baby visit. Other offices may choose to do it at different intervals, but I definitely recommend that you do it at least twice, because our first Edinburgh depression screening test for this person was actually very normal. And so I think it's offering the test, I think in some way shows that you're open to hearing about what they're really thinking and feeling. It is something that is billable, and so certainly it is not something that's going to cause a lot of cost. And I think if you spend the time up front and really involve your office staff, it won't take a lot of time. I think the first step to do, if you're interested in Edinburgh screening testing, is to look at some of the studies that have been done. You can download the tool for free on the internet, and I'm certain that you can call the Arizona chapter of the American Academy of Pediatrics with some advice for workflows, policies and procedures, and implementation. I hope this information has been helpful, and I hope that you really think about implementing the Edinburgh postpartum depression screening in your practice. Thanks.